your guide to the safe and effective use of MicroClave Clear. MicroClave Clear features a clear housing, minimal residual volume, and straight fluid path, as well as a split septum silicone seal and internal blunt cannula, specifically designed to minimize contact between the connector's external surface and the internal fluid path upon lure activation. To begin, prime the microclave by attaching the connector, inverting, and priming with saline to expel air. Next, attach the male lure of the microclave to an extension set or IV catheter. To access the microclave, first swab the top of the connector with a desired disinfectant according to facility protocol. When the microclave is properly disinfected using a swabbing technique, microorganisms are removed from the access site of the split septum. The microclave accepts both spin lure and slip lure connections. Do not use needles, blunts, lever locks, alligator clips, or twin packs with microclave, as these will damage the connector and negatively impact its performance. To connect to the microclave using a lure lock syringe, swab the top of the connector with a desired disinfectant according to facility protocol. Push and twist the lure to the right until secure. Always hold the microclave while connecting and disconnecting access devices to prevent accidental removal. Connect the microclave to primary tubing similar to a slip lure connection if the end of the pump tubing has a slip lure and collar that moves. To do this, move the collar back and insert the end of the slip lure. Push and twist a quarter turn to the right to lock the lure in place. Move the collar back into place and twist to lock. To draw blood using a vacutainer, first swab the microclave. Then, using a syringe, withdraw and discard waste. Next, swab the connector and insert the lure slip with a push and a quarter turn. When removing the adapter, be sure to twist the adapter in the same direction to ensure that the needle is not removed and exposed. Once removed, swab the connector per facility protocol. MicroClave is also compatible with a saline flush protocol, which provides a cost savings to the healthcare provider and eliminates the risk of any clinical complications associated with heparin. To avoid any negative pressure that is associated with compressing the plunger to the bottom of the syringe, do not push all the fluid, leaving a small amount of fluid remaining in the syringe. MicroClave's neutral displacement technology allows you to follow any existing facility clamping protocol, whether before or after the male lure is disconnected. For more information on the MicroClave Neutral Displacement Needle-Free Connector, please visit www.icumed.com or contact your local ICU Medical product representative.